So one of the common running injuries is patella pain or kneecap pain. Your kneecap translates all the power that's generated by your quadricep muscles down through it into a single tendon that attaches into here. Okay, so there's a lot of load going through that muscle, and its job is to translate that so that the pull doesn't then rip the bone off your tibia, and it makes it all go in a single direction, nice line. So it's sort of V-shaped behind it, and it runs in a groove in the femur. So it needs to run up and down that groove to work smoothly. So a common cause of knee pain is to have increased wear on the actual groove behind, so it's not running smoothly in that groove. That may be because the muscle pull isn't even, it may be that the rotations going through your leg aren't even, or it may be that they're twisting between the two from what your feet are doing to what your hips doing, are rotating through there. Other forms of knee pain, you can have the actual muscles come down. They don't all just descend into there, they send other bits of themselves around the actual kneecap to give it a joint capsule itself. They can become inflamed as well, but again, essentially it's as your leg needs to remain stable in that position and in that position, the kneecap has to run smoothly up and down, so if it gets pulled out of position, it starts to wear. So effectively it's an imbalance between the damage that's occurring, so the wearing, and your repair mechanisms. What we need to do is work out why that's happening. So for it to be pulled in or out or rotation, so if it's coming from a foot cause, so if the foot is pronating too late into the step or too much, it will rotate the tibia inwards. After about mid-stance, in the middle of your step, your femur starts being rotated out by the hip. So you end up getting rotation like that occurring. That obviously pulls the kneecap in that direction and out of line. So changing the dynamics of the way your foot's working will reduce that sort of pain. If you also have a situation where you can't bend your ankle sufficiently, sometimes that will cause your kneecap to run out of alignment. Alternatively, if your hips aren't working how we want them to, sometimes that will cause a misalignment. So it's finding which part of that is causing the problem.